Water exchange for screening colonoscopy increases adenoma detection rate, a multicenter, double-blinded, randomized controlled trial. Introduction. Colorectal cancer, CRC, is the third most common cancer in the world, with nearly 1.4 million new cases diagnosed in 2012. Low adenoma detection rate, ADR, the proportion of patients with at least one adenoma found in the colon, is correlated with the risk of post-colonoscopy CRC. Considering that the effectiveness of colonoscopy hinges on the detection and removal of cancer precursors, novel approaches to improve ADR are desirable. Air insufflation colonoscopy has been reported to fail to prevent some post-screening right-sided CRC incidence and mortality. Its decreased effectiveness in the proximal colon, cecum to splenic flexure, compared with the distal colon, may be related to non-modifiable factors, such as unique biological features of right-sided cancers, or to modifiable deficiencies of screening colonoscopy. Small polyps with flat or depressed morphology and containing advanced histology are more common in the proximal colon than in the distal colon. These small presumptive precursors of cancer are possibly more easily obscured by residual feces and are more likely to be missed during colonoscopy. Water-aided colonoscopy, in which water is infused in lieu of gas insufflation to distend the lumen during the insertion phase, can be broadly subdivided into water immersion and water exchange. Water immersion is characterized by the infusion of water to facilitate cecal intubation with limited use of insufflation when necessary, and removal of residual water predominantly during withdrawal. Water exchange is characterized by the gasless insertion to the cecum in clear water, minimizing distension and maximizing cleanliness during insertion. Removal of residual water is done predominantly during this phase. Compared with air insufflation, the impacts of water immersion and water exchange differ. Water immersion did not significantly increase ADR, whereas previous studies suggest that water exchange might increase ADR, particularly for small-sized lesions in the proximal colon, providing salvage cleansing and improving bowel preparation. Limitations of the studies included their retrospective analysis, investigators unblinded to the insertion method, and lack of a direct comparison between water exchange, water immersion, and air insufflation with ADR as the primary outcome. In the current head-to-head comparison of the three techniques with blinded colonoscopists, Cadoni et al. Aimed to evaluate the impact of the three insertion techniques on ADR. The authors were also interested in the impact of water exchange in further improving colon cleansing. Background and study aims. Single-center studies, which were retrospective and/or involved unblinded colonoscopists, have suggested that water exchange, but not water immersion, compared with air insufflation significantly increases the adenoma detection rate, ADR, particularly in the proximal and right colon. Head-to-head comparisons of the three techniques with ADR as primary outcome and blinded colonoscopists has not been reported to date. In a randomized controlled trial with blinded colonoscopists, Cadoni et al. Aimed to evaluate the impact of the three insertion techniques on ADR. Patients and methods. A total of 1,224 patients aged 50 to 70 years, 672 males, and undergoing screening colonoscopy were randomized 1:1:1 to water exchange, water immersion, or air insufflation. Split-dose bowel preparation was adopted to optimize colon cleansing. After the cecum had been reached, a second colonoscopist who was blinded to the insertion technique performed the withdrawal. The primary outcome was overall ADR according to the three insertion techniques: water exchange, water immersion, and air insufflation. Secondary outcomes were other pertinent overall and right colon procedure-related measures. Results. Baseline characteristics of the three groups were comparable. Compared with air insufflation, water exchange achieved a significantly higher overall ADR. Water exchange showed comparable overall ADR versus water immersion. In the right colon, water exchange achieved a higher ADR than air insufflation and a higher advanced ADR. Compared with air insufflation, the mean number of adenomas per procedure was significantly higher with water exchange. Water exchange achieved the highest cleanliness scores, overall and in the right colon. These variables were comparable between water immersion and air insufflation. Conclusion. The design with blinded observers strengthens the validity of the observation that water exchange, but not water immersion, can achieve significantly higher adenoma detection than air insufflation. Based on this evidence, the use of water exchange should be encouraged. Trial registered at clinicaltrials.gov, NCT 02041507.